What is light therapy? Because you were on before and we didn't get a chance to talk about it, but I really want to know, what is light therapy?
Light therapy is something that doctors worldwide have been studying for the last mostly 50, 60 years. It's putting red light, blue light, and infrared light, which are the ones that have been studied the most, on the skin. And it helps stimulate nitric oxide, which is dilates blood vessels, so it brings blood to an area.
Nitroglycerin, that's what we use for nitroglycerin.
That's right.
Yeah,
yep.
nitroglycerin.
It really helps heal, can help heal things because it also dilates the lymph vessels and carries out the garbage. So you're bringing nutrition to the body and you're helping flush garbage out of the body.
So I imagine they can use it for wound therapy and for
healing
of bones and things like that.
It's very similar to massage. The benefits of the light therapy really correlate with what massage is good for.
Did you bring a sample with you so we can take a look at what it is?
My unit is
I'm so curious to find out about this.
Avalon is the name of the company that I bought the unit from. This is a professional unit. This is the back pad. In that pad there are infrared lights and red lights, as well as this one. And this is the iPad. You just put it right over your
eyes. It's
over your eyes.
I mean, because
this one is
infrared and
this one doesn't have infrared.
Okay,
this is just red and blue.
Okay.
That's why this one can go over the eyes or other parts.
I was like, whoa.
And the red light is good for certain things. Blue light it doesn't penetrate as deep, but it's very beneficial for other things.
Are they hot? Because you think of infrared heat.
Right.
Are they hot?
These are a special little LED lights. They're not your normal LED lights you have in a flashlight. Any light bulb you get some heat from. So it's not a heating unit, but there'll be a little bit of heat from the lights, but it's not meant to heat anything.
So if I have a pain in my back, or would I come to you and you massage it and then you use this? How would that work?
Okay, I do, because I'm a massage therapist, I do both. A lot of my massage clients have tried the light therapy. I gave everybody a free session to see what it was like to begin with.
You want to get some feedback.
And most of them want it again. Most of them find that with the massage and the light therapy combination, they get much better results than with just the massage. But I have a lot of people that also come for just the lights because, I mean, they both work. And just the lights on a sore back, or you can wrap these pads are very versatile. You can put them on any part of your body.
They're very flexible. You can wrap them around you.
We have little Velcro straps. You put them on your knees and ankles and hips and back and shoulders.
Now, why would you put them over your eyes?
This pad is very good for stimulating. It actually goes right into the brain and it stimulates the hypothalamus, which helps reset a lot of things in the body. You can put these pads. We can make a helmet out of the other two pads and put it on the brain. Brings blood supply to your brain. Helps bringing blood and nutrients to the brain. Helps a lot of different issues. We can't claim that it treats anything. What we can say is it brings blood to the area. Helps produce nitric oxide.
If you know what bringing blood to the area is, it brings oxygen and it removes the bad stuff.
It helps balance the body. Where it helps nourish the body, especially in the Northeast, but even these are used a lot in Florida too, or anywhere in the South. Our bodies need light. We're meant to have light. We are energy.
We talk about the circadian rhythm that people have, and some, they've got a rhythm. And what do they say, that there's that condition in the winter with deprivation of light?
SAD, seasonal effectiveness disorder.
Right, you got it. I couldn't think of it right off. And people do use light, but this is not what that's for.
This is not what that's for. This is nourishing the cells. This works on a cellular level. It actually helps, like I said, produce nitric oxide. It actually can also help stimulate the ATP production in the cells, in the mitochondria, which is the energy source of our cells. So it works on a cellular level. In fact, Harvard University is studying light therapy on a cellular level right now. NASA took light therapy in their shuttles when they went to help heal things and help, as a medical device almost.
How often? I mean, is this something you would buy and take home and use?
You could,
yep.
They have, if you look online, you'll find all kinds of light therapy machines. This is more the professional unit. We can cover a bigger part of the body. It's very gentle work, but very effective. What was your question? How often?
Yeah, how often?
When you hook this machine up, I have a little box that you can set different settings. There's the thing that's unique about this is you can set 7 different settings or these other combinations of things. and it's a 20-minute session. I plug it in, put it on the body for 20 minutes. Okay. You can do it,
you can't do it
every
too much.
4 hours.
Okay.
So maybe 3 times a day, so up to an hour a day.
Yeah, that's really interesting because I had no knowledge of the light therapy or exactly how that worked, because
it's not something that you hear about. It's been around for a long time.
You're at the ground floors,
right?
Pretty much.
Veterinarians were the machines were FDA approved for veterinarians to use in 1983, I think it was.
Okay.
So they've been using it on animals, and it's just something. All these alternative things you kind of get put by the wayside, and you don't know about them until you're introduced to them.
Well, and we do have to realize that alternative therapy is. I mean, you're talking acupuncture. We're talking physical. Well, not physical therapy so much, but massage therapy and Reiki and a number of those. Certainly, everything is not going to be solved with a knife and a drug.
Right.
Right?
Yep. Instead of taking an Advil or a Motrin or an aspirin, you put this on the achy joint, and you're not having other problems.
And it may even allow you to use less,
exactly.
Even if you do have to have it for the anti-inflammatory. Yep. Maybe you need less than you would normally, and the less stuff you put in your body, the better it is. And I'm speaking as a pharmacist. I just know that you don't want to put a lot of stuff in your body. But if you need it, take it. But if you don't need it,
short term.
Right.
This is better long term.
Long term. This is good.
And I think you're going to see a lot more of this come in the future. This is the first unit that has been in the Capital District from this company. This is the state-of-the-art machine. We just had a talk, which was standing room only. We're going to have another one in Saratoga soon. In fact, May 31st. But you're going to be seeing light therapy. They're starting to advertise it on TV now. Robert Wagner has a little light therapy unit. It's not as effective as this, obviously.
No, I'm sure the professional units would be.
But it's coming.
Right. Jane is with the Healing Path Massage. They're located on Franklin, Yeah, Franklin Street. And you can always check that out and maybe give her a call if you want to learn a little bit more about it. I'm sure, or if you're going to another massage therapist, ask the one that's in your area. Maybe they'll know more about it too. Thank you so much for being here and telling us a little bit, because I had no idea what it was. And now I know. That's what Schenectady Today in and around the Capital Region is all about. You're going to learn something new on every show.